Shifting focus now, bird flu has been dominating headlines. The U.S. state of California, which is also the biggest milk-producing state there, has now confirmed 2 human cases of bird flu in people who were in contact with dairy cattle infected by the virus. In the U.S. alone, this shoots the number of infected people who were in contact with dairy cows and poultry up to 15. Another person in the state of Missouri with no immediate contact with animals as well has also tested positive. The virus's jump to cattle in a total of 14 states in the U.S. has gotten scientists and officials scratching their heads about risks posed to human beings from further spread. Should they press the panic button at this point? Let's just get you some context here. As per the California Department of Public Health, the human cases in California are not interlinked, which basically suggests only animal to human spread of the virus in the state. One of the infected, who is a dairy worker at a facility which reported bird flu cases in cattle, suffered conjunctivitis or pink eye, and at this point is receiving antiviral medication and self-isolating at home. Thankfully, neither of the two reported respiratory issues or chances of hospitalization so far. But what's really going on? In late August, cows at dairy farms in California began testing positive for bird flu. The department further verified that dairy products and pasteurized milk bear no threats and are safe to consume, also adding that even though the risk to general public remains low, those interacting with the infected lot of animals are at a higher risk of contracting the flu. The healthcare workers attending to the Missouri patient showed respiratory troubles, but the virus has not been confirmed in any of them. It may be a bit too early to predict if this is a case of zoonotic transmission, which is basically any disease or infection that spreads easily from vertebrate animals to human beings. The U.S. Food and Drug Administration will soon start testing cow milk set for processing at dairy plants to check if the virus is prevalent in milk. So far, participation of the trial to begin from October 28 is voluntary, and prior test samples show negative results. Meanwhile, deaths of 47 tigers, 3 lions, 1 panther have been reported from the zoos of South Vietnam after a deadly bird flu outbreak. How serious is the situation really? Are human beings at risk as well? What are the authorities saying? Our next report gets you the details.
In South Vietnam, the H5N1 type A virus has been identified from test results from the National Center for Animal Health Diagnosis as the reason behind a string of animal deaths in the months of August and September at the private Mai Quin Safari Park in Long An province in Vuon Chuai Zoo in Dong Nai near the capital. Fortunately, the zoo staff members in close contact with the animals did not face any respiratory symptoms so far. But are they out of danger, and how many more animals risk dying from the virus? Here are some numbers to consider. According to Education for Nature Vietnam, an NGO focusing on wildlife conservation, a total of 385 tigers were living in captivity in Vietnam at the end of 2023. Among them, almost 310 are kept at 16 privately owned farms and zoos, while the rest seem to languish in state-owned facilities. The World Health Organization flagged increasing reports of deadly outbreaks among mammals caused by influenza viruses. Since 2022, in humans though, this virus manifests a bit differently. The strain can range from being mild to severe, even fatal in certain cases. In 2004, dozens of tigers fell prey to the bird flu or were culled at the world's largest breeding farm in Thailand. Back in March, Vietnam even notified the World Health Organization about the virus, spreading wide and far and claiming a human life. Not just that, earlier this year, the WHO reported the first human case of death from the H5N2 bird flu. WHO spokesperson Christian Lindmeier also expressed his concern over the incident.
The infection of H5N2 is being investigated to see whether he was infected by somebody visiting or by any contact with any animals before.
Globally, experts are concerned about increasing rise in bird flu-related incidents. But how did the animals get infected exactly? The big cats likely caught the virus after consuming meat from infected poultry. However, this isn't common at all. According to an epidemiologist at the University of Hong Kong, big cats have caught and even survived avian influenza before that spread across Southeast Asia in 2003 and 2004. But the latest outbreak has left alarm bells ringing and triggered serious questions about the immunity of these animals. Bureau Report, WION World is One.
To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.